Cool. Thanks everyone for attending. The TIs are going to do their presentation about asthma and the Asthma app that we've been using for over a year now. And then Hayden's going to also do a talk at the end to tag on to that. So I'll hand it over to the TIs. Do you want to just do a brief introduction of your name as well, given that's your last week on the run, just so people know?
Sure. Hello everyone, I'm Kyujin Kim.
I am Joe.
I'm Corbin.
And I'm Stephen.
If you can recognize our voices. So we are TI Group 4 and we are gathered here today to discuss a subject of utmost importance, which is the evaluation and audit of our very own Asthma Education App. So over the past 4 weeks, we as a group have dedicated our time to collecting extensive and never before collected data on the Asthma Education App in an attempt to better it for the future generations to come. So without further ado, let's start. So may I have a show of hands how many of you guys have seen the Asthma app before? Oh, wonderful. So as you can see, it's very well received. However, for the sake of those who have not, we are just going to go through what the app is about. So,
Yeah, so pretty much this is what you'll see when you enter the app on any mobile device, and it's divided into inhaler and spacer, and then you click on one, and then each one will have 3 different sort of things you can learn about: priming, cleaning, and using, as well as some background resources. And you can also test yourself as well. So if I just quickly go into, say, spacer cleaning, it'll start playing a little clip automatically, and that just takes you through the process of how to clean your spacer. And it's pretty much the same for all the other sections. And the test yourself part is where it's a bit interactive, and you can actually press on the iPad and to do things. So we'll just wait for this clip to finish. So if you go test yourself, it's pretty much, so on the touch screen we'll be dragging and dropping all the components, and it's got instructions at the bottom, so it's pretty easy to understand, and it's also interactive as well. Okay.
Yeah.
This probably, so Joe's just going to quickly talk a bit more about SMA.
So in terms of asthma management, research has well established that self-management is an effective and guideline-recommended approach to controlling asthma. However, recent studies have shown that asthma is fully controlled in up to 50% of the cases, and that is from research from British data, because unfortunately I was unable to find any sources of local data. Promotion, uptake, and use of self-management techniques among people with asthma, as well as their carers and healthcare professionals, also remains low. So in trying to understand more, I found this very recent paper, which was done in 2017, which is a meta-analysis on the barriers and facilitators of effective self-management in asthma, which looked at 56 different papers published between 1997 and 2017, establishing over 11 main themes of barriers and facilitators. Out of these 11 main themes, the top 3 which emerge are mainly partnership, medications, and education, as you can see on the screen. So in terms of partnership, one of the main issues raised was that there was an absence of partnership reported between the healthcare professional and the patient, particularly among adolescents as well as ethnic minorities. And in terms of medication, there was a general consensus about patient concerns over safety and side effect of the medication, and the predominant group was parents of the children, which is not unexpected, and older adults. In terms of education, there was complaints from both healthcare professionals and patients, with healthcare professionals bringing up things about having insufficient training with action plan use, and on the patient side, universal concerns about just a lack of understanding about asthma, the controls and triggers, medication, as well as appropriate usage of inhaler and spacer. So, so as this is an education app, we're gonna just look at the education options which have been trialed so far. So one of the more common education options would be written action plans, which I'm sure everybody is familiar with. Although frequently used, these have not been shown to demonstrate a significant improvement in several outcome measures when just used alone, and this was found in a study. Do written action plans help improve patient outcomes? And it's done, yeah, by the general, but it's done somewhere, not in New Zealand. And another systematic review, however, showed conflicting evidence showing that asthma plans based on peak expiratory flows actually improve health outcomes. So with regards to written action plans and their studies, there's been a lot of different outcomes being measured and a lot of different written action plans, so it's very hard to establish like whether or not there's an answer whether it works or not. So yeah, basically there's quite a lot of conflicting evidence about that. And other education options include community health worker involvement, which basically means the community health worker goes to the house of the child and talks to the parents and children and show them everything. However, although this has shown very good outcomes with actually improved symptoms in most of the randomized control trials out there, one of the major drawbacks would definitely be the costs, because I mean, imagine sending a community healthcare worker to every wheezy child that comes in. I don't think that would be a very sustainable and efficient long-term solution. School-based programs and peer-led programs were another option which I found, mainly involving kind of like just short discussions with students during recess, facilitated by the teacher, or maybe like some senior-led programs at the end of school. And these have shown some significant improvement in the quality of life, and in some cases reduce absenteeism. And the most interesting find that I found was bedside education. There was a big study about bedside education, and it found that family-focused bedside education, especially when delivered during an acute asthma hospitalization by highly motivated volunteers, is actually a very efficacious and low-cost approach to improving asthma self-management in the pediatric population, which is pretty much what our app aims to do. Having a very motivated medical student or doctor or healthcare professional deliver the app, and giving them the chance to ask questions, interactive, engaging the family, as well as being low cost and efficacious. And this is also part of technology-based programs, which are now a new emerging source of education options, which Courtney will talk more about.
Yeah, so obviously the app is sort of a form of self-management, and it's shown in many studies to improve the health outcomes. With recent developments in mobile technology, it helps to develop a platform where self-management interventions are adaptable, they're low cost, they're easily accessible, and they can be effective in kind of trying to prevent some of the key symptoms of a long-term condition. In one of the papers that I looked at, it showed the meta-analysis looking at 9 papers, which showed that there was statistically significant improvement in the measured outcomes with the interventions comprised only of an app, and these were looking at things like diabetes, lung disease and cardiovascular disease. However, in a lot of the apps, they did touch on the area where a lot of these apps aren't quite tightly regulated. There's a lot of medical apps that are available now, and they're sharing a lot of information, and there's not a lot of firm research or studies based around these apps, and also with apps dealing with privacy and things like that. And so that was a widespread kind of thing, and that also looking at the low health literacy and numeracy may also negatively affect use of soft drinks. Particularly looking at asthma apps, it showed that asthma education within the paediatric population showed reduced number of hospitalisations, and that health plans invested in paediatric asthma education were positive. However, there was also the question about many apps suffering from low quality, and that reviews can be helpful when considering the support tool that we use, and also getting feedback on what areas of the app were most helpful for patients and families in order just to address future.
Yeah, so in terms of the design of our audit, our participants generally include children requiring the use of the inhaler and spacer, whether it's on a regular basis or as needed. And a lot of the children that we've seen for this audit generally have bronchiectasis, viral-induced wheezes, or asthma exacerbations. So we gathered data through two methods of collection. Firstly is the paper survey, and that's an example of the Asthma App evaluation study paper survey that we've put up and kind of put across to the participants as well. And this was done across three weeks from the 26th of April to the 16th of May. And some of the questions that we put on the surveys, we wanted to know the ratings of parents or caregivers or children would give for this app, and also whether they would have any other comments in terms of suggestions to improve the app or any drawbacks or flaws that the app might be having at the moment. And the second method is looking at collection of data that was done on the app itself. So the app has like an online survey that's inbuilt, and that was collected from November 2018 and May 2019, and we kind of retrospectively analyze those data and see the ratings that were given. And those were the 4 questions that were in those apps. So how useful do you find the content? Do you learn anything new? Would you like this application to be available from home to share to others? And was the content easily understandable? So the next slide, I'll be talking about the data analysis of the online survey. So there were a total of 32 participants that we found on that did the asthma app survey online. And as you can see, generally, majority of the participants gave us a rating of 4 to 5, which is really good for across all 4 domains. There are a few low ratings there. One, content use, also learning. But as this is a retrospective analysis, we were not able to identify the reason for that low rating. And there were also 2 participants who did not rate some of the domains, and because looking at back of the data, there were no kind of record of why they didn't do it at all. So we have no clue as to why they didn't do it. Yeah, I think Eugene will be talking more about the paper survey that we've been doing in the past 2 weeks.
So the paper survey that we did over the last 3 weeks, we got a total of 9 participants. However, 1 participant declined to use the app, and also 4 of the children did not give a rating, mainly because they were too young. And again, majority of the parents and the children gave a higher rating in the 8, 9, and 10, and this was scored out of 10. However, it's noted that 1 child also gave a rating out of 5 out of 10. But more important from the paper survey was the comments and in the feedback that was given in written form. And then the general feedback was that it was well received and with commendable results. And a lot of the parents learned how to clean and prepare inhalers for spaces. Many of them didn't even know that you had to clean them. They also commented that it was fun and interactive, and then the kids tend to enjoy the self-test quizzes where you actually are interacting with the iPad and pressing on the screen and playing around with it. However, based on our experiences and then the feedback we got, we found that it would be more useful to add an option to pause, skip, replay, or go back, because if you accidentally click on one of the videos, it'll start playing by itself and there's no way to pause it or go back. And also perhaps to add some background music to help engage younger children, as they're much more easily distracted by like TVs in the wardrooms or toys around them. So I guess the conclusions that we can draw from this is that apps in education it's really taken off in the past few years, and there's a huge potential out there in healthcare and in education in general, but there also needs to be a degree of caution because it's not really that well researched in terms of ethical or privacy reasons, and sort of things like what happens to the data and then who gets the data. So it needs ongoing feedback and research in order to improve it. But however, as Joe mentioned, a lot of the papers did mention that asthma education would improve technique and management and prevent unnecessary admissions to the emergency department, which leads to decreased strain on hospital resources as well. And also using the app, it's really quick and easy, and it's like an effective brief intervention. Most parents spend about 10 or so minutes using the app. And then while I'm there, they can ask me questions if they have any, and it's a good way to monitor and see if there's any issues with their technique as well. Yeah, so, and then those are all our references from the papers that we mentioned. And I think now Dr. Hayden's just going to go over what he's found in his community.
Do we just continue?
Just what Hayden gets it set up. So I think it's really good, isn't it? Because it's always amazing when you look at the evidence base for asthma, something which is really common. It's actually not very convincing on a number of aspects, so you cover that really well. And just while Hayden's loading his talk, I think there are some neat new ideas about what we could do. How would we measure that that was better? How could we do that? If we say, oh, let's put the background music in there. How could you measure that was actually a good idea? Any thoughts?
I guess it's difficult to come up with like an objective measurement, but I guess subjectively, what we observe from the world as well. Like I've done a few of the surveys myself, and just from the interaction with the kids, because there are a few who are, as Eugene said, they're quite distracted as well, and I think having that music there and watching the interaction with the iPad and the app as well could be an indicator that it might be.
Basically just subjectively watching, seeing if they're more
because I don't know, it's
engaged.
quite difficult,
I guess
in my opinion.
and I guess that the scoring, so if we use the same feedback form and the scores are also objectively higher, and then the only thing that we have changed is the music, I guess, maybe.
Can I just check, is the app just given to the child to play on by their own, or are you doing it? Are you doing it with the parent, engaging with them to go through each
Yeah, so we usually give the iPad to the parents. I mean, that's what I did. I don't know what the rest of the students actually come up with, like a uniform plan as to how to. But I usually give.
Yeah.
It's often done with the nurses. I think they did cover that at the start as well.
That's really great. Yeah, I mean that's the best practice. I mean, so the guidelines around app use in general as educational tools or tools to engage children is that if you have what they call it, you've got it, regard or something that's to do with the parent holding the child and engaging with whatever is on the screen together, and that's the same as reading a book. Has the same amount of educational impact, and so therefore it's not a screen anymore. It's really just a tool for delivering interactive content that you process with your parent. So,
Good ideas. We'll move on to Hayden's bit.
Is it alright to have it on the left? I can't seem to put it up on the right.
Okay, no, I can fix that.